My name is Tim Brown. I'm a consultant transplant surgeon in the Belfast City Hospital in Belfast in Northern Ireland, where we carry out around 130 to 140 kidney transplants every year. In this particular case, this gentleman had a number of glands which needed removed, and given that their anatomical position is variable, that's the nature of parathyroid glands, we had explored his neck twice, having removed all of the glands that we could see, but unfortunately after we'd finished he still had a gland that what we felt was missing. So when imaging him with traditional 2D imaging, so axial CT imaging, we could see the gland, and despite seeing the gland, we still were unable to find it intraoperatively, and that's what prompted us to see if a 3D model would assist us in this type of surgery. So how did the model help? Well, redo surgery in the neck is fraught with danger. There are an awful lot of blood vessels and nerves that we're operating very close to, and if we've already been in the neck, then the scar tissue there makes identification of the anatomy particularly difficult and hazardous. So having spent a couple of hours on each occasion looking for this gland and being unsuccessful, the 3D image that we got from the model, and I'd like to maybe just point it out here, this is, in my view, a work of art really. You can see that this is the sternum and this is the pectoralis muscle at the front of the chest. You can see the windpipe here, and the grey coloured is the thyroid gland. All of these, I'll turn it around backwards now, we've got the arch of the aorta and the blood vessels going up into the head. These are the carotid arteries, and you can see maybe tucked in here, you can see this little yellow gland, and this is the gland that we were looking for, that we could see on the 2D imaging, but unfortunately in real life we were unable to find. So in terms of interpretation of the spatial imaging, what we were able to do was take this model and really look in depth in our pre-operative planning as to how we would actually discover this. And you'll see that there's a little vein here. What we decided to do was to open the neck, find this vein, and then follow it down into the chest. And 15 minutes later, we were able to find this gland, and the operation was over in 15 minutes. There was no trauma to any of the surrounding structures, and we knocked off a good 2 hours off our potential operating time. And with removal of this gland, this gentleman was cured of his condition, to the extent that we were then able to list him for a kidney transplant. And 2 days after we listed him for a kidney transplant, he then received a successful kidney transplant, and he's doing extremely well afterwards. So in terms of interpretation, imaging, and translation into an outstanding clinical outcome, that's what this model provided. I think one of the benefits that I've learned, having used these models on a number of occasions for very complex cases, is in terms of patient empowerment and patient education. Trying to describe and discuss complex anatomical variations with patients using a CT scan is a very difficult thing to do, because CT scans take an awful lot of training to be able to interpret. And if I'm showing those to patients, then it's all very well showing it to a radiologist, but a patient is not going to be able to interpret what a CT scan looks like. But what has really shocked me is the level of understanding that a patient can then get if you hand them a 3D model. It's like a light bulb moment comes on for them, and they look at the case and go, doc, I understand what you're talking about now, and I get why you're worried about doing this particular case, and I get why this might be particularly concerning to you. That's so much clearer to me. So I've had those conversations on a number of occasions now, having used the 3D model, and it's an unexpected sort of side effect of 3D models is when a patient is fully educated, then that makes them autonomous, and that makes them empowered in terms of decision making about their own body and about their own treatment. So to me, it's a very powerful tool that we have now in our armoury of looking after patients with high quality care. When you look at a two-dimensional image, in my head, I then need to recreate that into a three-dimensional space, because that's what I'm going to be dealing with when I'm operating. And if I look at a 2D image, then I recreate it in my head. And if I get another colleague to look at the same picture, then he's recreating the same image in his head. But neither of us know if the two images that we've created in our heads are the same. So that leads on to what I think is quite a dangerous concept, which is unacceptable variability in clinician interpretation of scanning. When we turn those 2D models using the machine learning and the algorithms that XL3D have created, when we turn those 2D images into a 3D model such as this, then that takes away all variability between clinician interpretation. And it means that we're all working off the same sheet, if you like, that we will be going into an operation fully prepared, knowing what the anatomy is without variability between clinicians. 3 words that would describe Axial: patient-centered. Everything they do is centered on good patient outcomes. Professional, everything that they do is around a satisfied end user, which is phenomenal to have. And innovative, the tools that they have invented from scratch literally now are world leading, and it's a real privilege to be involved with XL3D.